adults now, but kids soon. Where is the COVID-19 vaccine for kids? Top focus at this hour.
Thank you for being with me here on 5 Live. This is a show that a lot of our viewers have requested us to do after we've done many on other issues concerning COVID. This one, very particular, very specific. Where is the vaccine for children? Is it coming? How long will it take? And the many other questions surrounding it for parents and otherwise. This is a question on top of many people's minds as we gear up for what is said to be the third wave, which could affect children much more, some experts say. Thanks for tuning in. Big show answering all your questions up ahead. I'm Shiv Aroor. These are the headlines. States continue to send SOS over vaccine shortage. Low stocks leading to chaos at vaccination centres across India. Government expert panel recommends increasing the gap between doses of Covishield vaccine to 12 to 16 weeks. No change suggested for Covaxin. COVID recovered advised to defer vaccination by 6 months. India's third approved vaccine, Sputnik V, to be available in the market from next week. Production in India to begin from July. Weeks after going into lockdown, COVID cases in Delhi dipped. Over 10,000 cases recorded in the last 24 hours. Test positivity ratio also down by half. Deputy Chief Minister says capital's oxygen requirement has also reduced. Karnataka's active caseload is the highest in the country with nearly 6 lakh cases. Daily cases also high and closing in on Maharashtra. The state's medical infrastructure under tremendous pressure. It's the question that every parent is probably Googling about. It certainly is on top of every parent's mind, and people in general are wondering about the answer to these questions. When will the COVID vaccine be available for children? From newborns to children up to the age of 17, when will it be available? Will it be the same vaccine as that which is being given right now to adults? Will the vaccine for children be a safe vaccine? Will it be anything different? Will kids face the same side effects as adults are facing now with certain vaccines like pain and body ache and fever and things like that? Very important question. How are clinical trials going to be conducted on children? There have been some clearances for vaccines to be trialed on children. How are these going to be conducted? There are ethical issues there. Could vaccination be mandatory? Very important. Could it be mandatory for children to allow them back into school? On the other side of this pandemic, whenever schools open, will schools make it mandatory that children need to be vaccinated? Over the next half hour, we're going to get you questions and answers. And some of the questions which may not have answers, we will do our best to answer them. And that's the reason why we have on our show, very happy to have on our show today, Taram Sharma Saluja. She's an actor and a mother. Dr. Swapnil Parikh is author of the book Coronavirus. He's a well-known physician based in Mumbai who keeps very close track of vaccine developments in India and around the world. We also have with us Simone Khambatta. She's a designer and a mother. And Dr. Shalini Tyagi is a pediatrician. She's the head of pediatrics department at Metro Hospital in the national capital. Welcome to all of you. Thank you for being with me. Really, really important subject here. We're all dealing with vaccinations right now for adults, but this is a question I know is on top of your minds for sure, because we have to deal with it at some point of time. Before I come to you, I want to tell you that there has been news regarding this particular topic, because in a major boost to that journey towards a vaccine for children, the Drug Controller General of India has approved phase 2 and 3 trials of the Covaxin vaccine for children from the ages of 2 to 18 years. Take a look at this report and then we'll go to our experts and parents.
As pediatric wards get crowded with young ones, one thing is very clear. The coronavirus is not leaving children unaffected. The second monster wave of COVID-19 is seeing more children get infected, even those less than 5 years old. And now, a vaccine for children could be the only ray of hope against the highly infectious variants. India's indigenous vaccine maker Bharat Biotech spoke in 2020 about developing a COVID-19 vaccine for children in India. But it is only now that the firm has obtained approval from the Indian drug regulator to proceed with trials. The DCGI has given a green signal to Bharat Biotech to begin phase 2 and 3 clinical trials on children aged between 2 to 18 years, as experts weigh in on the need to now vaccinate children.
Covaxin may take time, but we should vaccinate this group as soon as possible to prevent the third wave. One. Second, why it is important? Because in pediatric age group, you cannot isolate them in room. You cannot confine them in room. Very soon they will be out to the schools. They can be super spreader. They are very near and dear to the grandparents. So they can be very injurious. If they become contagious, they can be very injurious, very unsafe for the elderly. So we need to vaccinate them.
As kids remain locked up in homes, the vaccine for children and adolescents could help return children safely back to schools.
This is more to have a final fight against the COVID, because children can be involved in transmission, and by doing so we can safely open up our schools and the other activities which children have not been able to do, like camps and sports and other gatherings which they have not been able to do. So that will be a huge boost. Please give it to your children as and when this is offered and the scientific world clears it off.
The US FDA has approved Pfizer's COVID-19 vaccine for children of 12 to 15 years of age. Pfizer has also asked the UK drug regulator to give a go-ahead to vaccinate the kids in UK.
Even as Bharat Biotech has now been given permission by the SEC to begin trials, we'll still have to wait for at least several months before we could have a vaccine to protect children against the coronavirus. But experts have warned that the third wave, which is impending, could target children more than adults, because estimates suggest that by such time, many eligible adults would have at least taken one shot of the COVID-19 jab, which will make children and the younger population susceptible to getting infected, which is why vaccination for younger children is the need of the hour. In New Delhi, Taram Sharma for India Today.
Let's get straight into our discussion to try and answer some of these questions. But first, let's get the questions. I'm going to start with the parents. Tara, I'd like to start with you. You're a mum of 2 young children. I'm sure this is a question that you've had. You know, the adults are running around trying to get their vaccines. They're having enough trouble. But are you also at the back of your mind wondering, when is that vaccine going to come for my kids?
Firstly, thank you very much for having me here today. It's an honor to be here.
Great to have you.
And I think this is thank you, and it's a very relevant topic, and it's great to be among such a august company. I think for all of us, of course, the biggest priority is good health for us all, for everyone, for us all to be safe, our children to be safe and fine, touch wood, and for eventually physical schools to start.
Yeah.
This second wave has been absolutely tragic. I think all of us have been deeply affected by what's going on, and want to do everything we can, of course, to help people. But I think it's a terribly high price to pay. But if anything, it's also woken everyone up to honestly addressing children.
Yes.
And if I'm very honest, as a young mother, I have found that over the whole year, while we've all, of course, been, doing everything to protect the older population, and of course, that has been the most vulnerable group, at some level, we've not really talked about children or about schools. And I find finally we're doing that. I, in fact, interviewed, because I have a show, the Taram Sharma show, I interviewed Dr. Mahesh Balsekar, and it was an extremely reassuring conversation on Saturday, where he actually spoke about while we're all afraid as parents, the first thing we need to do is all of us get vaccinated, because I think most children are actually getting COVID, if at all, from parents. So the first step, I think, is all of us getting vaccinated. And then, of course, as you rightly say, now really addressing children getting vaccinated too. And I'm very glad, I've been following the news very closely, and the fact that Covaxin is now going to go into trials, that Pfizer has been approved. In fact, just yesterday, there was a change petition that started floating around about, please, let's bring in any internationally approved vaccines for children and let it all happen parallelly. So I think, while of course I'm no expert and I don't know about rollouts and how it should work, I would just really hope and pray that this can all happen parallel. So while the older people are being looked after and the middle, I hope the kids are able to be vaccinated.
Yes. And you know, Tara, it doesn't really matter that you're not an expert, because even the experts are sort of feeling their way through this pandemic. We're all really learning, and that's the reason why also that Swapnil and Dr. Shalini are some of the best experts in the country right now in terms of understanding this entire unfolding story as it goes along. Simone, you're a mother of 2 young children as well. How are you dealing with those questions in your mind about when a vaccine, a credible vaccine, is going to be available for young children? Because the experts are saying that the third wave, and we have a lot of graphics on our screen which explains why experts are saying that the third wave could put the burden of infections on young children. What are those questions in your mind as a parent, Simone?
Hi, Shiv. Thank you for having me here. This is an absolutely relevant topic, as Tara said. It's something that every parent wants to know right now.
Yeah.
And of course, as a parent, not only do I want to get vaccinated and finish my second shot as soon as possible, but I want that for my kids more than anything else, right? Because I feel like my kids, especially because they're so young, they're the ones suffering the most right now. They can't even verbalize how they feel. And it's horrifying to see children go through this. And what's worse is that kids are getting affected in the second wave. And we're hearing all these kinds of stories, and it's really heartbreaking. But of course, when it comes to a vaccine, there are many questions that come into my head. I mean, we've recently heard of a rare but a problem that's happening with kids called MISC.
Yes.
And that is happening because of excess antibodies that are affecting different organs of their body. And it's horrifying to kind of even imagine. And I hope no parent ever has to witness that and no child ever has to go through that. But of course, the questions come up that, with the vaccine, will those antibodies affect the children negatively? Could there be those rare cases? There's so many. The questions are endless right now, because it's not just a regular flu shot, right? It is a vaccine with limited trials. So yeah, my mind's racing, and I know everyone's is, and we're waiting to hear from the experts.
Incredibly, you've put it so well. Everyone's mind is racing, and parents of young children especially so, because it's not just about their own vaccinations, but also the vaccinations of their children. Not just parents, nephews, nieces, people who are in charge of young Indians, principals of schools, teachers. This is a responsibility for everyone, not just parents. Before I come to you, Swapnil, Dr. Shalini Tyagi, you must be getting mums like Tara and Simone on a daily basis in your hospital, in your office, for various different ailments, asking you the same questions that they're asking you right now. How do you answer those questions, Dr. Tyagi?
Yes, that is so true. Every parent will have the same question, no matter you're treating what kind of disease, you're vaccinating or something else, but every parent has the same question. What do we do to protect our younger ones, right? Now, unfortunately, Shiv, if I had a one-line answer and I would have, reassured everybody, okay, everybody's kid is going to be fine, I would have been the happiest person around. However, though we don't have something very, magic on our hands, but we do have these vaccines which are in the pipeline.
Yes.
And all young parents, they are not, new to vaccinations. They've been visiting clinics, they've been giving vaccine shots to their children as well. And they have been, seeing the side effects like crying, pain, fever, which are usual anticipated side effects, right? So I don't think they're scared of those side effects. However, what we need whenever we have to give a vaccine to the child, there are two very important issues. The first issue is efficacy, whether it is going to go protect my child or not. The second and more important issue when we use a vaccine in pediatric age group is safety concern, right? So whenever a vaccine is given a license to be used in children, the safety is the utmost thing that has been kept.
Yes.
That is why we still have so many diseases like malaria and so many other diseases which are still not conquered by the
Very true. Yes.
vaccines, in spite of the science getting so advanced. So I will want all the parents to be reassured that if the vaccine passes the phase 3 trial with flying colors, it will be really, really prudent to give all our children the vaccines, because the disease is there in big way. Our younger ones are not vaccinated, not exposed. They were at homes. They're not,
Yes.
they don't even have natural immunity. And they're going to be much more vulnerable once they come out for attending the school. So if the phase 3 trials reassure us, which will be wiser after some months from now, I would ask all the parents, including me, to go ahead and take the vaccine.
Okay, so that's very straight advice coming from one of India's top pediatricians. Dr. Swapnil Parikh, how would you address some of those concerns and questions that Tara and Simone have just raised as parents? Because, we've got so much on our hands right now as a country. But like I keep saying, this is something that can't indefinitely be deferred, because people are going to wonder. There are experts saying that the burden of infection may shift to the younger ones, once the adult population gets increasingly vaccinated. So parents are concerned, Dr. Parikh. How would you address those questions?
Hi, Shiv. Thank you for having me on your show. It's a very important topic we're discussing today. I'd like to start with a slightly different perspective. So if we look at India's demography, 40% of our population is below 18.
Yes.
So our current target for vaccination is the population that's above 18, and that's 60% of the population. It's actually pretty difficult to get to the herd immunity threshold required for containment by only focusing on the 60% of the population that's above 18. So if we want to control this virus and get down to containment levels as per the defined criteria, then we definitely need to vaccinate kids below 18.
Yeah.
Then, of course, there is also the consideration that while in most children, coronavirus is a very mild infection, there are some children who either due to pre-existing conditions or due to immunocompromise do have severe outcomes, and we can't exclude the possibility that there will be variants that emerge in the future that do target kids, that do hit. It's possible. It's not, we can't say that that's what's going to happen, but it is a possibility.
Yes.
So we do need to vaccinate kids. We have to define which vaccine, what dose, what schedule. There's also another very important point to consider. We know that the coronavirus now, the SARS-CoV-2, is evolving faster than we initially thought it would. So once we vaccinate the 18 plus population, if we let it just spread through the pediatric age group, there is a possibility of viral evolution there. It's also possible that they could infect immunocompromised friends, immunocompromised relatives,
Yes.
their immunocompromised grandparents, and that could cause viral evolution with vaccine-beating variants. So our ultimate objective to get out of this pandemic is as wide vaccination coverage as possible.
Right.
However, there are very important questions before we get there. As other guests pointed out, we do need to establish safety and efficacy to reassure parents. Now, this becomes a little problematic because we still do not have peer-reviewed or publicly available phase 3 efficacy or safety data on Covaxin. The trial, we should have had this by now. I'm not suggesting that the vaccine isn't a good one. It's just that the information hasn't come out very quickly. And I'm already vaccinated, but I would take Covaxin today. It's also very difficult because we don't have real-world data. We should have had this. A lot of people have been vaccinated. This data analysis should have been done.
Right.
And we should have had this data to make decisions. It's very important we start these pediatric trials. But considering we're looking at an age group between 2 to 18 and the sample size is just 525, I think when you subcategorize by age, it's far too small a sample size. So the study actually needs to be much larger. And then there are other very important questions.
Yes.
Should we vaccinate kids in India before we ensure adequate coverage of the elderly in Africa or other low middle income countries. There are important questions of equity. These vaccines, not with Covaxin, but with the other vaccines, many of them have been designed abroad.
Right.
They've been brought into India for manufacture on the contractual obligation to supply them to low middle income countries, and it's morally and ethically the correct thing to do.
Yeah.
So from an equity lens, we need to ask ourselves, is it correct that we put Indian kids in front of the elderly in other countries? Important questions to answer.
Yeah,
and trials are so important because in children, we have to establish that whichever vaccine, whichever dose, whatever we're doing, the benefit of vaccination, both to the children and society, outweighs any possible risks to them.
Right.
So it's very
Absolutely.
important to do these trials.
I just want to address that issue. We have a report, on the third wave, which I'm going to play out for you in just a moment, and how there are experts who believe, using real world information and data, that the third world is likely to see a larger percentage of the younger ones being infected as the caseload decreases among the elder population because of increased vaccination. Tara, the issue of safety and efficacy is probably the number one issue for all parents, isn't it? Including you. Because Dr. Tyagi made a very good point when she said that Indian parents are not new to vaccines. We've been taking our babies to get vaccinated, for so long. India is like, in many ways, the vaccine capital of the world. But this is COVID. This is completely new. This is a once-in-a-century pandemic. We're still really understanding it. How prominent is safety and efficacy in your list of concerns when you're thinking about vaccine for your children, Tara?
So I would actually very much agree with Dr. Tyagi and all the panelists here that, we have to have trust in the international bodies that are actually approving and carrying out the trials. A very senior doctor once said to me when my father was unwell, he said he didn't become a top doctor by looking up Google. So I think the first thing we need to do is have trust in the bodies that are actually doing this and are doing it effectively internationally. I keep using the word internationally because while we've spoken about Covaxin, the truth is Pfizer has been approved. I believe in Canada it's already being rolled out for children. In the US, I think 15 and above are starting to. So again, I'm sure AstraZeneca is doing those trials. I'm half Indian and half English. My sister lives in England, very much aware of what her kids are up to and what they're doing.
Yeah.
I think by July, they're planning to start giving it. So I think personally, as a parent, I have implicit trust in our doctors and our pediatrician, which is why perhaps I interviewed Dr. Balsekar, and Dr. Balsekar also said, of course, once it's approved, to have that trust and take it. I think for a lot of us, it's now going into the second year of this. There's an element of frustration, languishing. People are questioning everything.
Yes.
But what we also have to do is carry optimism with the fact that there's a lot more knowledge now. As much as it's super frustrating that the kids are still home, the reality is we know a lot more now than we did this time last year. In fact, small things like I ensure our kids play in our garden with protection and safely every single day. I still believe in the power of physical immunity being built with exercise, things like that. Of course, with the safety precautions, ensuring masks if there's anyone else around. So I think one also has to keep drawing from that optimism.
Yes.
I keep saying, my biggest prayer is that we're all safe and healthy. Our kids are fine, touch wood, and that physical schools open safely. I'm not political and I'm not controversial, but for 1 year I haven't spoken up about how important I feel it is that we prioritize healthcare and education above everything. To me, it's above economics. Of course, everyone needs their bread and butter, but with basic income, I think we now need to look at education. We are still talking about a minority of highly privileged people sitting here on our panel. I'm well aware of the privilege. My children, they're thriving. Although they miss their physical school, they are at home, in an environment where my husband's around a lot more. They're getting, to learn from an amazing school that's doing well online. But what about the huge, huge majority of children in India who do not have access to gadgets,
So true.
to online, who may not have save homes, who may actually be victims of abuse and other things. We really now need to prioritize children, vaccinations for everyone, healthcare and education. And
Absolutely.
I would personally give up my work, my socializing, my travel for years if my children could safely be back in school. I think
I'm so glad, Tara, that you mentioned privilege, because all of us, I mean, I think collectively need to look beyond our privilege at the experience for so many people out there, and the figures that Dr. Parikh just gave us, that 40% of this country is below the age of 18, and an overwhelming percentage of that 40% are not privileged folks like you and me, is going to be the huge challenge in this vaccine rollout, even while we talk about this. But speaking about, yeah, absolutely. Yeah, you wanted to add something, Tara, to that?
Just one tiny point that
Yes.
our son actually, our older son with a friend, they did a project on quality education, and they spoke with Shaheen Mistry of Teach for India.
Yeah.
And it was alarming that she said in an average Teach for India environment, an average child has had 10 days of online school in the year. So what we are talking about is such a minority, and if we're feeling the pinch,
Yeah,
I can't
yeah.
even fathom what they're feeling. So we need to do this.
I'm glad you said this. I'm glad you said this because it's important to it's important to acknowledge that there is going to be this reach issue. There is going to be a problem with vaccine coverage even when this vaccine for children actually arrives, even though India has had great experience in rolling out vaccines, but we've got to acknowledge that there is a gap here. Simone, I understand that you had quite a bit of fever after you got your first shot. All of us have had some discomfort after getting that first shot. But, keeping vaccine hesitancy aside, this must be a concern for all parents as well, because they're just hoping for the best possible information, the best possible data. And like Dr. Parikh also, put out, in a hurry to get to the vaccines, even for our children, every parent will be hoping, I hope you guys are sampling enough, because this is our children we're talking about.
Shiv, when it was my turn, forget about me, when it was my parents' turn to get vaccinated, my parents live in Dubai. So the Pfizer rolled out there in December, a lot before we got it in India.
Yeah.
And my parents, being senior citizens, obviously the first thought was, oh my God, what if something happens to them? But I think it comes down to a place where you really have to trust your doctors and trust science. And as long as you can do that and know that those same vaccines are being given to those doctors' parents and those doctors' children too, and they're not going to guide us incorrectly. So I think it all comes down to just having trust and faith in the body that is the kind of expert in this field.
Yes.
Right? Because otherwise we can come up with all kinds of conspiracy theories. We know the conspiracy theories on the vaccine are endless. And I'm not the person who falls for those. And I urge all the parents to really just not, kind of go by Google and go by the conspiracy theory. Listen to your doctors. They know best. They're going to guide you in the best possible way. Have faith and go for it, because as doctor said, once the phase 3 trial is over, be rest assured that it is safe for your child.
Absolutely.
So keeping that in mind,
Yes.
I will get the vaccine the minute it's out.
That's you've raised such an incredibly important point. The fact that there is so much misinformation out there on social media, on WhatsApp. I see Dr. Parikh every day on social media, busting a lot of myths, trying to add, scientific data to the conversation. But it's such an uphill task on really a daily basis, because even the experts don't know everything that there is to know about what we're dealing with here, even when it comes to vaccines for children, that there is that much more space for rumors and, WhatsApp forwards and things like that. And who is ever more vulnerable than parents when it comes to their children? They are always going to be susceptible to misinformation. I think that's one very important thing we need to deal with. Before I go back to my experts, let me play out for you this story that we've done through our reporters about the third wave that's coming. Remember, the government experts say there's going to be a third wave. We're handling the second wave right now, but there is going to be a third wave. And here's why many experts believe that young children will have the burden of infection in this upcoming wave.
Even as India battles a second coronavirus wave, the threat of a third wave looms large. and experts say that it will be children who will be most vulnerable. Already, several children below the age of 18 years and newborns are now testing positive for COVID-19. States like Maharashtra have already set up a special pediatric task force in anticipation of the third wave that will procure medicines, ventilators, and build COVID care centers for children. The World Health Organization, however, says there is no evidence that the third wave will impact kids.
Children, we've seen from the beginning that while they can get infected, especially children under 10 are usually asymptomatic, usually not picked up and don't get sick. And it's very rare serious events that we see in children who are infected. The multi-organ inflammatory syndrome, it's a very rare complication.
While the COVID threat for children does exist, the only solution, the vaccine, seems to be a long way off. The government's expert panel has cleared phase 2 and 3 trial of Bharat Biotech's Covaxin on children between the ages of 2 to 18 years. Pfizer-BioNTech vaccine has been approved by the US FDA for 12 to 18-year-olds. American President Joe Biden has asked for immediate vaccination of young teens. Moderna is also conducting KidCo vaccine study for kids aged 6 months to 12 years. One thing is for certain, we need to protect our children and do so fast. Bureau Report, India Today.
As we come to a close of this particular discussion, and we've been getting a lot of questions and comments on social media as well, Dr. Tyagi, what would you say to all young parents in general out there who have all of these questions and are looking for answers? I can tell you they're all tuning in right now. What would you tell them?
See, there are 2 points. The first, as the number of people are getting infected, the virus is going from one person to other multiple millions of times. So once the virus travels like this, it has more chances of getting mutated. So far, so good. We've been lucky that children were saved. They had less severe disease. But there's a possibility that the new virus, that the new strain that might come in the third wave might affect the children. Point 1.
Yes.
Point 2, children are not vaccinated, so they remain the vulnerable group. Point 3, children have been protected. The schools and colleges and play areas were all restricted. They were not getting exposed. So with these 3 pointers, there is definitely a possibility that we, as we let our guards down by the end of the second wave and our unvaccinated children go out and kind of play together and get in touch with each other, there is a probability that they get infected.
Yes.
So yes, there is a probability. What can we do? We'll vaccinate. Once the vaccine comes, we'll vaccinate. That is the most effective tool. That has been a tool for ages together. That's how we've conquered diseases like smallpox,
yes,
right?
Absolutely.
Second, a good nutrition, a good health, avoiding obesity, having a dance hour at the house or yoga time at the house will definitely affect. Nowadays, I see children as small as, maybe 1 year or so entering into our clinics wearing the mask nice and clear. So they can be taught and they understand. So teaching them right hygiene habits, social distancing, hand washing and wearing a mask is important. We'll want to inculcate all these habits into all our children very well.
Absolutely.
Right? So we'll do whatever we can, but we have to protect them.
Imagine this generation of young children facing this kind of crisis so early in their lives. It's just impossible to imagine what they're going through. I mean, they're just learning and feeling their way through the world, and they've already got masks and sanitizers being imposed on their daily lives. But, the question of school, Dr. Parikh, isn't it realistic to expect that, for schools to open and welcome kids back, it'll probably be compulsory for kids to be vaccinated?
That's I'm not sure that we can take that policy because it'll be a very long time before we manage to vaccinate everyone below 18. I think we have to look at the harms of keeping school closed versus do we wait till everyone is vaccinated? Realistically, I don't think it's feasible to expect that that's going to happen very soon.
Okay.
Just a couple of things I want to point out. We also do have the possibility of single dose intranasal and oral coronavirus vaccines down the line. And I think every conversation we have about vaccinating kids, we need to clarify children may be susceptible to infection. The vast majority of children are not vulnerable in that they have severe outcomes. There's a difference between being susceptible to infection and being vulnerable in the sense that if you are infected, you are likely to have a severe outcome.
Right.
I think even in 2022, the people most vulnerable in the world are going to be the elderly, because there will be several countries where people are not expected to be vaccinated, healthcare workers, the elderly.
Yes.
And I think it is incumbent upon us to lead every conversation with a disclaimer on equity that yes, we need to vaccinate kids once we have data, once we establish the science, but we also have a responsibility to make sure, because it's the right thing to do, that everyone in the world who's most vulnerable is protected also.
And this is a global crisis, so you're absolutely right. And that's very reassuring information that you're also giving us about children, because parents will take anything that's reassuring at this time. I have a 6-year-old as well. So, any information that's positive, I'm going to hang on to it, even though I realize that there is so much that is still unknown. My final questions are to the two parents, to you first, Tara. Even the youngest of kids, like Dr. Tyagi pointed out, are aware of the coronavirus. They know what's going on. They know why they need to wear a mask. They probably know, about their parents getting vaccinated as well. How is that conversation going between you and your kids, Tara? Do they ask about vaccine? Do they want to know when they'll need to get vaccinated? Because one thing's for sure, they want to know when life's going to get back to normal. But are they asking you specific things like vaccines as well?
Shiv, quite honestly, as I've said, I try and uphold the badge of optimism as much as possible in this difficult time. And the kids are so advanced. Yeah. I have to say, as are now 9 and 11, and they tell us what they've been reading. In fact, I think it was our older son who even told me when Pfizer was approved abroad and when people started taking it. And so they're actually, if I have to say, like I mentioned, we must always acknowledge that we are part of a privileged few who have this kind of, access. But the reality is they are very aware. And I think they are also aware that they need to trust, like we've been saying, everyone here has been saying, we need to trust the experts. Once it's approved, once internationally it's approved, and once hopefully the authorities are able to bring in vaccines, whether they are indigenous or from outside, we all have to have implicit trust and take them for our children, give them to our children when they're allowed. And I think kids, once they know that they trust their parents, they trust their doctors, we will not question that. I'm pretty sure they want to get back to regular life. I just have to say, just as I reiterated earlier, while I think, of course, we need to protect the vulnerable, and there is no doubt that every person's life is so important, I do think that the fact that we're having this conversation, it shows a lot that the narrative has changed to the fact that we've been addressing that children and education need to be brought to the forefront. And I think as Doctor mentioned, it's not just about having everyone vaccinated to open schools. I believe there's a very clear guideline of the percentage of infection below which it's okay to open schools, with, of course, great safety protocols. And I think all over the world, even when they've had terrible second waves, they've managed to keep open predominantly. Again, I refer, because my sister's in the UK, I think for months the schools were shut, but then even without the vaccine they found ways to do it. So while we have a much larger population and we have to be mindful of that, I do think there are ways, if if positivity rates go down, if all adults are vaccinated, I do think that even before all the kids are vaccinated, there are ways to open school. And I hope so, because I think we all really on that note,
yes, every kid wants to do that. That's their biggest question, not just playing with their friends, but when school's going to open. Simone, you had a lot of concerns as well. My final question is to you, Simone. Before you took your vaccine, you got your shot. How are you? What is your conversation with your children like over the vaccines? You as a mother had concerns. What are your kids asking you and how are you answering them?
Okay, so Shiv, my kids are really tiny. My daughter's almost 2 and my son is 3.5. So my son has just understood coronavirus, because he doesn't understand why he can't have play dates in his small bubble with those 2-3 friends like he was before the second wave hit. He asks about them, and I have to explain to him that there's something called this coronavirus, and it's not just. So initially he got scared. He thought that coronavirus is inside his house. So I really have to constantly, consistently, with a smile on my face, explain to him that he's not alone. We're all as a community going through this together.
Yeah.
Human beings are going through this together, and he's understanding it. He, like I said, he's too small to be able to verbalize everything as yet. And as far as you're asking me about my symptoms, when we went for the shot, I took my staff at home with me too, because I wanted to make sure they got their shot. And each one of us had such different kind of side effects to the vaccine. No one was severe. And the thing is, we anticipated that, right?
Yeah.
Doctors already told us that this is a possibility. So take your paracetamol. And I was fine. I didn't have a problem with the side effects at all. As long as I was getting that vaccine, I was happy. And I'm really looking forward to my kids getting it when the time is right. And like Tara said, more than anything else, every single parent in India is waiting for schools to open. Dubai has set such a solid example.
Absolutely.
Also. In January, when I was there, the cases there were so bad because the UK variant came in and they shut schools temporarily for a bit. But now it's back again. It's open. Yes, our population is an issue, but I'm sure, we will get there. And one more thing before we close, I just want to say that as much as the experts anticipate this third wave, we as individuals have to put out that positive vibration out there that the third wave is not going to happen. We will find a way together to end this. I don't know how it's going to happen, but it has to happen.
I hope you're right, Simone. I really hope you are right. We'll have to... We're going to...
Conversations like this are so important because unfortunately, as we saw, there were no such conversations that much before the second wave. So hopefully...
We're much better prepared. Like you said, Tara, we're learning along the way and we're better prepared with information right now. And that's why it's also a privilege to be able to share this information through people as luminous as all of you with our viewers. Millions of people are going to be benefiting from the words of the four of you today. I can guarantee you that. And the one thing we can all agree on is the young children of India are probably going to grow up even faster thanks to this crisis. That's a very sobering note that we all have to make our peace with. But that's the reality. That's the hand we've been dealt, and we have to play our hand and see how we get through this crisis. Thank you very much, Tara. Thank you, Simone. Thank you, Dr. Parikh and Dr. Tyagi. Please stay well. I wish all of your children also the very best. And thank you for being with me on this show. Thank you.
Thank you so much for having us. Thank you.